What is Toujeo, Insulin Glargine? Toujeo, available as Toujeo Solostar and Toujeo Max Solostar, is a long-acting insulin glargine formulation used to help manage diabetes mellitus in adults and children. It contains a more concentrated version of insulin glargine, 300 units per milliliter, (ml), allowing for steady blood sugar control with once-daily injections. Toujeo, Insulin Glargine, is supplied as pre-filled injection pens, designed for convenient, accurate dosing. It works gradually over 24 hours or longer, helping keep blood sugar levels stable between meals and overnight. What is Toujeo, Insulin Glargine, used for? Toujeo, Insulin Glargine, is approved for use in managing both Type 1 diabetes mellitus, for adults and children who require daily insulin for blood glucose control, Type 2 diabetes mellitus, for adults whose blood sugar levels remain high despite oral diabetes medications, diet, and exercise. By maintaining a consistent level of insulin in the body, Toujeo supports better long-term glycemic control and helps reduce the risk of diabetes-related complications. How Toujeo, Insulin Glargine, works. Insulin glargine, the active ingredient in Toujeo, mimics the natural insulin your body produces. It helps move glucose from the bloodstream into cells, where it's used for energy. Additionally, it reduces glucose production by the liver, which helps lower fasting blood sugar levels. Because it is long-acting, Toujeo delivers a slow, steady release of insulin throughout the day and night, providing more consistent control compared to short-acting or intermediate insulins. Possible side effects of Toujeo, Insulin Glargine. Like all insulins, Toujeo, Insulin Glargine, can cause side effects. Most are mild and may improve as your body adjusts to treatment. However, some can be serious and require medical attention. Common side effects: cold-like symptoms, nasal congestion, sore throat, upper respiratory tract infection, mild hypoglycemia, low blood sugar. Other possible effects: fluid retention or swelling in the legs and ankles, weight gain, local injection site reactions, pain, redness, or swelling, changes in skin thickness or texture at the injection site. Serious side effects: seek immediate medical help if you experience severe hypoglycemia, shaking, dizziness, confusion, rapid heartbeat, sweating, or intense hunger, low potassium, hypokalemia, muscle cramps, weakness, constipation, or irregular heartbeat, allergic reaction, rash, hives, swelling of the face or throat, or difficulty breathing. Always use Toujeo, Insulin Glargine, exactly as prescribed by your healthcare provider. Never share your injection pens or needles with others, and regularly monitor your blood sugar to track how well your treatment is working. For patients with type 1 or type 2 diabetes, consistent insulin therapy, combined with healthy lifestyle habits, remains essential for optimal glucose control and long-term health. Toujeo, Insulin Glargine, dosage forms and cost. Toujeo, also known as Insulin Glargine 300 units per milliliter, (ml), is available in pre-filled injection pens designed for convenient, once-daily dosing. It is typically supplied in cartons containing 3 1.5 ml pens, each pre-filled with the concentrated formulation. The average cost for one carton of Toujeo, Insulin Glargine, is approximately $367.08 when using a GoodRx discount coupon, representing about 28% off the average retail price of $512.28. Actual prices may vary depending on your pharmacy, location, and insurance coverage. Dosage form quantity approximate price per unit 3 pre-filled 1.5 ml pens, 300 units ml, 1 carton $367.08 $367.08. Typical dosing for Toujeo, Insulin Glargine. Your prescriber will personalize your Toujeo dose based on your diabetes type, blood sugar levels, and previous insulin use. Always follow your healthcare provider's specific dosing instructions. If you're starting insulin for the first time, Type 1 diabetes. Your prescriber will determine your total daily insulin, TDI, requirement. The typical starting dose of Toujeo, Insulin Glargine, is about 30% to 50% of your TDI. Inject once daily under the skin at the same time each day. Type 2 diabetes. The usual starting dose is 0.2 units per kilogram of body weight, or up to 10 units per day. Toujeo, Insulin Glargine, is injected once daily, subcutaneously. If you're already taking insulin, switching from once daily long-acting or intermediate-acting insulin, your starting dose of Toujeo is typically the same total daily dose as your current insulin. Switching from twice-daily long-acting or intermediate-acting insulin, the recommended starting dose is 80% of your total daily dose from your previous insulin. Your healthcare team will adjust your dose over time to achieve stable blood sugar control, while minimizing the risk of hypoglycemia. Toujeo, Insulin Glargine. Contraindications. Certain medical conditions or circumstances can make Toujeo, Insulin Glargine, unsafe to use. Inform your healthcare provider before starting this medication if any of the following apply to you. Do not use Toujeo, Insulin Glargine, if you experience episodes of hypoglycemia, low blood sugar. You have a known allergy to Insulin Glargine or to any component of Toujeo. You are allergic to other Insulin Glargine products, such as Lantus, Dosage, or Semglee. If you develop allergic reactions, such as rash, swelling, or difficulty breathing, seek immediate medical attention and contact your healthcare provider right away. Pharmacist tips for Toujeo, Insulin Glargine: safe use, dosing, and storage. Before you start using Toujeo, Insulin Glargine. Before beginning treatment with Toujeo, Insulin Glargine, it's important to understand how insulin therapy works and what to expect. Have an open conversation with your healthcare team. They can guide you through the process and answer any questions you may have. Make sure you know which Toujeo pen you're using. Toujeo SoloStar contains 450 units in 1.5 ml and delivers doses in 1 unit increments. Toujeo Max SoloStar contains 900 units in 3 ml and delivers doses in 2 unit increments. Toujeo Max SoloStar is typically recommended for people who need 20 units or more of Insulin Glargine per day. If you're switching between pen types, your healthcare provider will give you specific instructions to ensure the transition is done safely. Managing low blood sugar, hypoglycemia. Toujeo, Insulin Glargine, helps control blood sugar, but it can sometimes make your blood sugar too low, which can be dangerous if not recognized early. You and your loved ones should know how to identify and treat low blood sugar. Common symptoms include feeling shaky, weak, or faint, rapid heartbeat, sweating, sudden hunger or nervousness. Always carry fast-acting carbohydrates, such as glucose tablets or juice, and use the 15 to 15 rule. Consume 15 grams of fast-acting sugar, wait 15 minutes, and recheck your blood sugar. Repeat if it's still low. Preventing mix-ups with other insulins. Some people may use different types of insulin throughout the day. Always check your insulin labels carefully to ensure you're using the correct one at the right time. If you ever feel unsure, contact your diabetes care team immediately. Using the wrong insulin by mistake could cause dangerously low blood sugar levels. Monitoring blood sugar and staying consistent. Regularly check your blood sugar at home or as advised by your healthcare team. Keep a record of your results and share them during follow-ups. This helps your care team evaluate how well Toujeo, Insulin Glargine, is working and whether your dose needs to be adjusted. Even if you skip a meal, do not skip your daily Toujeo dose, unless your doctor instructs otherwise. Toujeo helps maintain your baseline insulin level, keeping your blood sugar steady even when you're not eating. Try to maintain consistent meal times and exercise routines. Avoid sudden changes to your daily habits without consulting your healthcare team, as this can impact how your insulin works. How to use Toujeo, Insulin Glargine. 1. Administration. Your healthcare provider will show you how to inject Toujeo correctly. Read the instructions for use carefully and ask questions if anything is unclear. 2. Needles and injection technique. Always use a new needle for every injection to prevent infection or blocked needles. Never share your needles or pens with anyone else. Note that pen needles are not included, so you'll need to purchase them separately from your pharmac. Why? 3. Timing of injection. Inject Toujeo once per day, preferably at the same time each day. This helps maintain a consistent insulin level in your bow. DY. 4. Inspect before use. Check that the insulin inside your Toujeo pen is clear and colorless, with no visible particles. If it looks cloudy or contains clumps, do not use it. Return it to your pharmacist for a replacement. Perform a safety test before each injection to make sure your pen is working correctly and delivering the right dose. 5. Do not mix insulins. Never mix Toujeo, Insulin Glargine, with any other insulin in the same syringe. If you're prescribed another insulin, use separate pens or syringes for each. Do not use Toujeo in an insulin pump. 6. Injection sites. Inject under the skin of your abdomen, thighs, or upper arms. Rotate injection sites each time to prevent skin irritation or thickening. Avoid areas that are bruised, scarred, or magged. 7. Disposal. After each use, safely dispose of needles and empty pens in a sharps container or a heavy-duty plastic container such as an empty detergent bottle. Never throw used needles directly into the trash to avoid accidental injuries. If you found this video helpful, don't forget to like and subscribe to HeInfo, your trusted source for science-based health education. Leave a comment below if you have any questions about using Toujeo, Insulin Glargine, and we'll cover them in future videos. Stay informed, stay healthy, with HeInfo.